Hello, athletic training students. Welcome to your online lecture for management of medicine in athletic training facilities or clinics. I can say after practicing in the field of athletic training that I have some stories. I won't bore you here in this online lecture, but I have seen some really good management of medicines that are being stored in the athletic training facility, and I have seen some atrocious management of medication in the athletic training facility. In particular, I'm going to get close. I'm getting intense already. In particular, what I've seen are like big, Costco, Sam's Club size bottles of ibuprofen just sitting out on the counter, and student athletes just coming in and like pouring the bottle and just throwing it in their mouth and then going to practice. That's a mismanagement of medication in the athletic training facility. I think what is extremely important about this online lecture that we're about to venture into is a few key things. You are an advocate for athletes, right? Athletes trust you. In our previous lecture, we talked a lot about the potential for abuse. And yes, I said over-the-counter medications most often have the lowest propensity for the development of addiction, for the development of adverse effects, right? But the reality is we know that they are readily accessible. And for that reason alone, it makes it more likely that our athletes will abuse them, right? So they may not become addicted, but they might certainly abuse them a lot more, take higher doses than they're supposed to take them more often, to do this thing that I call is suppress their pain so they can make it through the game. And if you're an athlete watching this, you probably have done that. I'm not going to lie. I was a track athlete. I had a stress fracture, 800 milligrams of ibuprofen was going in my mouth every 2 hours just so I could get through the jumps. And now looking back on that, I realized that was a terrible choice or decision to make. So what I'm going to say to you is that as you move into assistant or head athletic training roles, it will be your job to make sure that your athletes don't have easy access to the medications in your athletic training clinic. I'm going to start here first. Anytime the NATA or National Athletic Training Association has a consensus statement or a position statement, you have to be aware of them because they are something that can be placed on your board certification examination. But more importantly, one of the reasons that the consensus and position statements are important is because they tell us what we can do as athletic trainers. So instead of me having to Google to find them or to search for the laws on athletic trainers, if we go to the consensus statement or the position statement, then this is going to be the easiest way for us to determine whether or not we are doing things the way that we are supposed to be doing them, the way that our governing body says that we should be doing them. So all that to say, you're going to see different screenshots of this particular article throughout our lecture. And then I've also posted that in the Canvas modules for reference for future. So let's talk classifications of medication. I think this is actually a review, so I'm going to go through this quickly, but you know what? I don't want to assume. In addition to that, we have two other classifications that we didn't talk about in the chapter 1 lecture, so I want to add those. But our first classification and most commonly readily accessible type of medication is going to be an over-the-counter medication. The one thing that I'm going to add here, the one thing that I'm going to say here that was different from the previous lecture is that our over-the-counter medications have to be in what we call our single dose packages in order for us to actually give them to athletes, right? We can't just dump the bottle in their hand and then let them walk off. So one of the key things with over-the-counter medications is, one, we have to make sure we're tracking all of the medications that we give patients. Two, we always want to do what we call our unit dose or single dose packaging, which means as we look through this, if you were to buy have you seen the Motrin boxes that come with 1,000 packages of 2 pills in each, and you just take the package, open it, and then they put that in their mouth. We know that that is the actual dose that they're supposed to be taking, and that is what we can do as athletic trainers. Next, we have prescription drugs. We already know this. Prescription drugs can only be prescribed by a physician. Now, interestingly enough, we can, on the behalf of an athlete, if they give Signature to us, we can actually go pick up the prescription medication for them from the pharmacist. But most often the athlete will go pick up the prescription from the pharmacist, and the pharmacist, you all have experienced this, Would you like to learn about the drug you're going to be taking? Most of us say no, but they offer the opportunity to teach the patient about dosing, about adverse side effects. We all usually blow it off, but it's important to allow the pharmacist their opportunity to tell you about all of the things that could go right and could go wrong with the actual drug itself. So that's prescribed, right? The next is going to be controlled substances, right? Remember, we have controlled substance number 1, which is most often not prescribed in the United States. Controlled substance number 2, which is prescribed but not refillable and has a high psychological and physical dependent. And then we could go 3, 4, and 5, with 5 being the least concerning because it usually has a lower potential for abuse and doesn't have as much of the psychological dependence associated with it, right? Those controlled substances are interesting because most often, most clinics will not be able to store them. However, if we do store them, so if our physician does give us a written permission to store them, they have to be stored separate from our prescription and separate from our over-the-counter drugs and medication. And all that to say, our OTCs, our prescriptions, and our controlled substances should all be under lock and key. And we'll talk a little bit more about that in just a second. The 2 categories that we didn't talk about in chapter 1 are compounded pharmaceuticals and samples. So your compounded pharmaceuticals, as the name kind of implies, is going to be a pill or a cough syrup that is created in the actual pharmacy. So you'll go and you'll say, hey, my name's Nicole Cosby. I have, I don't know, the last time I got compounded pharmaceuticals and I had this cough that would not go away. So my physician sent in this prescription and it had codeine, and then it had acetaminophen, it had ibuprofen. So 3 kind of different chemicals all being mixed together. And so the pharmacist will most often kind of mix those together. Same things when my kids get antibiotics. So they have ear infections, for example. When I go to pick up the antibiotics, it's most often fluid. And usually it takes about 20 to 30 minutes to get it because the pharmacist is going to ask for their weight and then is going to mix the antibiotics based on their weight. So these compound pharmaceuticals are most often kind of contain mixed drugs and are mixed on the site. Another one might be like some of the anti-inflammatory lotion that you'll rub on your patients. That's also mixed and combined, but that's an example of compounded pharmaceuticals. They are always prescription based, and so again should be stored with the prescription drugs. And then an interesting category are actually the samples. I don't know if any of you, if you've worked at a D1 institution, I'm sure you've seen like pharmaceutical sales individuals walking into the clinic and being like, hey, I have this new anti-inflammatory drug. Do you want some? And then they'll just like out of their bag, they'll just dump a whole bunch on the counter. So these samples are administered doses. And I think I'm going to get to the next slide and define what administered means, but let's talk about it now, right? So administered means it is a 1 dose to be taken within 24 hours, right? So you'll get lots of those samples and you can hand one out to the patient. As long as they take it within 24 hours, you are good to go, right? The same thing applies though, because they are prescription based most often, you still want to follow all of the guidelines for dispensing or administering that are on the back of that particular sample package, right? So for review, if we're reviewing, because review is never a bad thing, I hope you know this, right? An over-the-counter drug does not require a prescription from a physician. A prescription drug obviously does, right? OTC drugs, you can purchase them on the shelf in stores. You have to purchase a prescription drug and bring your prescription to an actual pharmacy for a pharmacist to distribute. An OTC can be used by more than one person, right? I could go purchase ibuprofen and then I could share that bottle with anybody in the class if I wanted to. I'm not, but I could, right? A prescription is intended for the one sole user whose name is on the prescription bottle. And then both of the OTC and prescription drugs are regulated by the FDA, and that's different for controlled substances. Controlled substances are regulated by the DEA, Drug Enforcement Agency, so very different structures regulating those. All right, let's define a few things. Administer, dispensing, and therapeutic intervention. They all are different, and they all dictate what we can do as clinicians. So athletic trainers, I think A and A. Athletic trainers administer. As athletic trainers, in the scope of our practice, we can administer. What does that mean? It means we can give the patient one dose, and that one dose has to be consumed within 24 hours, right? Anything outside of that would be outside of the scope of our practice. So example of those one dose packages that I was referring to, you can see you could give a patient one of these, walk away, let them take it, and have them come back, right? What would not be okay would be to take a handful of these and be like, take these for 3 to 5 days and come back and see me, right? That would then be what we call is dispensing. So dispensing is we give medication to the patient and we give them a lot of the medication and it is consumed outside of the 24 hours. So anywhere from 25 to 72 hours or even longer, right? And so we consider this to be what's called a therapeutic dose pack, where they're taking it over multiple days consecutively to hopefully cause an effect and reduce the signs and symptoms that brought them to us to begin with, right? We can't do this. Now, there are ways around this, right? We have these things called standard operating procedures. We have a team physician who might write in what we can dispense. But when we really look at our practice acts, the only thing that we're able to do within the scope of our practice is administer, which is to give one dose. And then the last thing is what we call as a therapeutic intervention. This is something that's intended for quick dosing. So an example of that would be cortisone injection, EpiPen, for example. I'm just trying to think of things like that. An inhaler would also be a therapeutic intervention, right? These are things that are going to be like more urgent or emergent in nature. And again, we most often can't utilize any of these. For example, a cortisone injection we shouldn't be doing, right? We could do an EpiPen, and then an inhaler, technically the patient should be doing that, not us. So these are the different definitions that become important as I start talking through the rest of this online lecture. Our role is to administer medication, one dose, single packet, hand it over, right? We really don't dispense. That is to the autonomy of the physician. With that said, a workaround is to have your physician write in standing orders that do allow you to dispense. And if something happens, then that's on the physician and his or her medical license, not yours, right? But if you are by yourself at a high school and you do not have a physician, you should not be dispensing drugs. You can give one dose and that's it. It should be consumed within 24 hours. Now, can you make recommendations? Yes, make recommendations as per the back of the bottle. I'm giving you this one dose, but if you want to go purchase a bottle of ibuprofen, make sure to take 2 pills every 4 to 6 hours. As long as you're giving advice that follows the actual instructions on the bottle, you would be within professional limits. I hope that clarifies and makes sense. So the team physician is extremely important. I don't know how much we've talked about this throughout the program, but the team physician is key. So in this image, you have the team physician for most of the Texas sports, right? So the Texans here, but all of the Texas sports, this is like the guru of team physicians, okay? So let's talk about the team physician. When you have a team physician, or what we call as a medical director, that's what I would call them. This individual is a licensed physician who takes responsibility for all medications that are stored in your athletic training facility. So it will become important for you to have a good relationship with your team physician or medical director, because they kind of help dictate which medications you can actually have stored. The great thing about most athletic trainer, medical director, team physician relationships is they will approve single dose over-the-counter medication. So I'll give you the common ones: ibuprofen, Aleve, and APAP or Tylenol. Those are the 3 common over-the-counter ones. But then some of the prescription-based ones, they might also approve for you to store in your clinic and use as necessary. And so I'm thinking about things like iontophoresis or phonophoresis, where you actually have to squirt an anti-inflammatory medication, most often dexamethasone, onto the pad. So they'll kind of create prescriptions for you to store those vials of dexamethasone in the clinic. They might want you to have all of the drugs that are necessary for a cortisone injection injection so that when they come into the clinic to do the cortisone injection, they don't have to pick it up. It's already there. So you have to really have a good relationship with your physician. Now, as it relates to controlled substances, it's very rare that a clinic would store controlled substances, but if they do, then like I said, they're monitored by the Drug Enforcement Administration or agency. And so that physician must be registered with the DEA, which oftentimes most physicians are. And then for every, let me say it this way, for the FDA and the DEA, for every clinic that you have that stores prescription and controlled substances, that physician has to have separate registrations in all of those locations, right? So that physician has to report to the DEA and the FDA where those drugs are being stored. On our campus, it's hard because we just have one athletic training clinic. But if you go to the likes of UCSD or USD or state, there's multiple clinics across the campus that you might be working in that might store medication. So that physician will register Bob's Field House, the Central Athletic Training Clinic, the small athletic training clinic on the baseball field, and you will also keep inventory of those drugs, right? Now, as you travel, that becomes a different issue, right? One of the things that's really hard is as you travel, and you will learn this about athletic training, your ability to do certain things in each state that has licensure will change, right? Because when you're in Oklahoma, you have to abide by the rules for athletic trainers in Oklahoma. So it'll become important for you to understand what those rules and license rules are. For a physician, the same thing applies. You can't presume that a team physician can travel to every state and prescribe in every state, because that's just not the case. Some states do not allow physicians who are not licensed in that state to prescribe or to dispense drugs in that state. So it'll become important as you're traveling to make sure that your team physician is aware of which state you're going to and is aware if you're taking prescription or over-the-counter medications as well, right? Okay, now we have these things called authorizations and agents of records. So in general, let's just talk about it this way. What we want to look at are what we call our non-discretionary and discretionary decisions. Discretionary decisions are decisions that are made by the physician because they have the ability to prescribe the medication. So those are all, when I say discretionary, I'm talking about decisions made by the physician. Any non-discretionary decisions are decisions most often made by the athletic trainer, the individual who can't prescribe, but can do so on behalf of the physician as long as they have written orders, right? So I'm going to go down this list, but I've already said it. Authorization to forward prescription orders on behalf of the team physician. You want that to be in your policies and procedure. Authorization to access medication in the cabinet to inventory control and to do record keeping. Your physician should write that the athletic trainer can forward prescriptions, is responsible for inventorying, is responsible for record keeping, right? Then if you really have a good relationship with your physician, this next bullet point is key to assist physician with non-discretionary decisions. So let's say you have a patient who has a knee injury and you want to give them, 10 packs of single dose ibuprofen. So your physician might write something in there that says, athletic trainer has the ability to prescribe within limits 7 days of ibuprofen for inflammatory response. Then that frees you up to do something called physician assisted, that's what we'll call it, physician assisted dispensation, right? All of these things, I'm saying all of these things to say that your policies and procedures as you move forward in the field of athletic training in your particular clinic are important. Your medical director should write all of the standing orders, free you from having to call him or her every single time that you actually want to treat a patient. So all of these things that are on the slide are basically stating you have to be in communication with your physician. And if your physician pre-writes these, then that communication reduces. And when you're unsure, then you make a call and you have him or her give you either permission on site, or they come in and do what you may not want to do with that particular patient. Now, there's this thing called treatment authorization. So mainly this is going to be in the field of athletic training. This is going to be for ionto and phonophoresis, right? These are the two kind of forms of treatment that are most often used in the clinical site that are that require prescription medication. Ionto being the pad that you see here, electricity driven through the skin to reduce inflammation. And on each side, you're going to put some type of prescription-based fluid medication in there that requires a physician's prescription, right? But again, it goes back to the previous slide where I said you must have that written authorization from the physician to do that. It'll tell you how much to dose, how much to put on each side of the pad. And then this goes for every single medication that you give a patient or that you treat a patient with. The name and the strength of the medication, the amount of the medication you use or the dose. You're going to do the type of modality that you use. Was it ionto? Was it phonophoresis? Your name, the physician's name, and the amount of time that you were actually treating that patient. 15 minutes, 20 minutes. These are all extremely important, and these should go in your SOAP notes, right? I'm assuming you all do this now, but if you don't, you should be doing this just to be safe. If your patient has an adverse skin reaction, for example, if your patient goes into, I don't know, some type of anaphylactic shock because you gave them something you weren't aware they were allergic to, these will all be things to keep in mind. Record keep as much as is possible. Okay, now we have this thing called athlete authorization. I mean, I don't know, it seems pretty clear to me what this means, but essentially as you are getting ready to pick up a prescription for an athlete, they must sign that it's okay for you to do that. So to pick up their medications, to store their medications in your kit, for example, if you're going to do that. I never did, but if you're going to do that. So for example, EpiPens are a common thing that most athletic trainers, or medications that most athletic trainers would store. The other one is an extra asthma inhaler. Those are prescription medications, whether or not we believe it or not. And so we have to actually have signed athlete authorization. So there are different ways to do this. I found this one from, I don't know, a policy and procedure handbook from a different college, but you can kind of see that here. They're completing the authorization for release of prescription information. So that's not only our ability to go and get prescriptions for them, but what prescriptions are they currently on? Historically, what prescriptions had they been on? We might be able to request medical records. So you'll have to have an athlete sign that authorization. This, oftentimes, I've seen this happen many times in the field of athletic training where we don't consider this. We just go get it without their permission. And it may very well be that they don't want us to grab the medication. And since it's in their name, we could be held liable. So you always want the athlete to release you from any liability for picking up their medications. Okay, there are several instances in the clinic where you can have what we call our unsecured medication. Which means they're not locked in a cabinet somewhere. The first rule is all medication should be locked and secured and stored, right? The exception to that are the three that you see there. So the EpiPen, because you want quick access. If a patient goes into anaphylactic shock, you want to grab that patient's EpiPen and you want to be able to stick it. You don't have to figure out where the key is. You don't want to break the key, right? So that makes sense. The other one is asthma. Same thing, life-threatening condition. And then this one right here, which is called ethyl chloride, or y'all will probably know it as spray and stretch, right? So the spray and stretch can live on the counter in the clinic because what is the risk for adverse side effect? It's very, 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 very minimal. So these are three medications that can be unsecured in the athletic training clinic. Most often, most clinicians will keep the EpiPens of your patients in like a specific drawer, and they're usually labeled with the patient's name. So those are all medications that can be unsecured, but other than that, everything should be secured. And so now we're going to talk about regulation agencies, right? I kind of should have done this maybe in chapter 1, but here we are. So your regulatory agencies, their major role is to protect the consumer and the public from a lot of different things, right? First, if we go back to all of those medical act or those food dispensation acts, right? We can see that ultimately the overall goal was to protect the consumer, but then also to make sure that the marketers of the drug were also holding true to the process, right? And so both of those are protectionary in nature. We want to prevent adverse side effects where we can, especially when we have patients taking drugs. And so you have your Food and Drug Administration. As you can see, they're going to be responsible for overseeing and regulating the manufacturing, the repackaging, the relabeling of prescription drugs. The FDA also regulates sample medication, right? We talked about that a little bit, and over-the-counter medications as well. Then next we have the Drug Enforcement Administration. You already know what they do. They oversee all things associated with controlled substances, right? That are ordered, received, stored, administered, and dispensed, right? And then you have OSHA, the Occupational Safety and Health Administration, OSHA, responsible for public safety regarding contamination, storage, disposal. So if you think about it this way, any expired drugs they're going to be concerned with. The disposal of the drugs they're going to be concerned with. It's like an extremely important process, right? In other words, we don't want to just throw expired medication into the trash. Think about homeless individuals who might be going through there and might take those, for example, or your kids who might go through the trash and might find something and take it and have an overdose. And then the last agency is the Federal Trade Commission. They're responsible for regulating medications transferred over state lines. So remember, we talked about moving from state to state and knowing the different state laws as you travel. This Federal Trade Commission is going to be very interested in you. And some interesting things have happened in the NFL with physicians traveling from state to state to state and kind of misusing their privileges. And so you've had the Federal Trade Commission kind of intercede in those instances, right? So now that we know the different agencies, we would say, okay, FDA, we know that's going to be prescription. We know that's going to be over the counter. We know that's going to be dietary supplements, right? DEA, we know that's going to be controlled substances by all means. OSHA is going to be really concerned with disposal of the drugs. And then you have your Fair Trade Commission, which is going to be all out of state concerned, right? So as we travel, again, we just need to make sure that we are fully aware of which states we're traveling to and what the practice acts are in that state. So we need to know state versus federal law, right? They're most often very aligned and very consistent. But if there is a conflict in the two, you go with the stricter of the two because you're always safer than sorry, right? So just make sure you go with the one that is going to be most strict, right? I have said this multiple times. I know you will do it probably once in your career, but to dispense medication, to give medication to an athlete outside of the use of 24 hours is considered dispensation, and that is illegal for an athletic trainer to do. Now, Dr. Cosby, but you said if we had written whatever, right? Yes, of course. If you have your written standing orders, then under the licensure of a physician, you can do that, right? At the high school, most of you will go there. You cannot dispense whatsoever. Most often you don't have a medical director. When in doubt, just refer out, right? And they can give them prescription, or they can give them the over-the-counter drugs that they actually might need or want, right? I've talked a lot about discretionary versus non-discretionary decision. Discretionary decisions are always made by the physician. They usually are the ones making the call. Your non-discretionary decisions are going to be made by, I don't like using the word unlicensed individual because athletic trainers are licensed in different states, but healthcare practitioners that don't have a medical license. That's the way that I would say it. Your textbook kept saying unlicensed, unlicensed. And I'm like, no, because athletic trainers are licensed. But I would say it's someone who is not a medical doctor or nurse practitioner or physician assistant. Okay, so let's talk policies and procedures. And so what you're going to start to see, I'm going to start trickling in examples from different places because I think it's important for you to see how things actually work in the field of athletic training. And I want to give you real life stuff, right? I don't want to just copy and paste from your textbook. So first and foremost, we have to have a policy and procedure manual in place. And that policy and procedure manual really truly should have an area where you're talking about dispensation of non-prescription medication, dispensation of prescription medication, dispensation of controlled substances, and compound/sample medications, right? If your policy and procedure manual is that thorough, it will save you later as you start to go back and have maybe patients complaining about your policies, right? So you want to define all aspects of practice and operations in the facility. One of those practices has to be the way that we administer medication. So here is an example of someone's policy: dispensation of non-prescription medication. the following guidelines at Indiana University of Pennsylvania. All non-prescription medications will be stored in a secure location with athletic training room, within the athletic training room and storage facility. Okay. Dispensation of non-prescription medications will be performed or supervised by a who? Certified athletic trainer, not an athletic training student, right? Records of dispensation will be kept on file in the athletic training room. The medicine dispensation record form can be found on this page. So you can see there's a step-by-step process, right? We're going to do medication inventory once a year. We're going to remove outdated medication and deteriorated medication. We'll remove that. And then the next step would be, well, how are you disposing of it, right? Because OSHA would care immensely about that. But you can see this is just one paragraph out of a policies and procedure manual. We need multiple paragraphs for who can handle the medication. Clearly, athletic training students, you really should never, ever hand medication to a student because you are not licensed, you are not certified, and so you don't really have the right to distribute medication. So be careful as you do that. If you're going to do it, make sure you have permission from the certified athletic trainer first on the dosing of that and how they want you to tell the patient to take the medication. Just be safe. Okay. We talked a lot about OSHA, and we talked about disposal of expired medications. And so what I've started to take from each of the consensus article are snippets, which you'll read it. But we're talking about expired medication. So what you want to do first, every year at the end of the year, you want to look through all of the medications that you have in your athletic training clinic, and you want to remove all expired medication from the active supply. So you want to separate them, right? You also don't just want to throw them away. You also want to record the expired medications, right? So 50 expired 2-dose packs of ibuprofen. And then you want to give that those expired medication to an outside agency. Most often it's going to be HAZMAT or OSHA, for example. So as we look through the consensus, here is what they say. Pharmaceutical hazardous waste must be disposed of in compliance with the organizational, local, state, and federal guidelines. This usually means that you have to call a disposable licensed hazardous waste agent. So that's going to cost you money, which is why some clinics kind of have like a biohazard area where they just dispose of expired meds. And then once that fills up, they call in the agency, right? So that can include expired medications. It could be, remember our IV kits, I had to call in HAZMAT to come remove those. The iodine preparations for surgery. I'm just giving different examples, right? So we want to make sure that we dispose of those. And then, of course, if it's controlled substances, we want to kind of involve the DEA in that process to allow them to kind of better check. And then in terms of security of drugs, I think I said this multiple times, all of the drugs in your clinic minus the 3 categories. So asthma inhaler, EpiPen, cold spray, all of the other drugs in your clinic should be under lock and key in a cabinet. Or if it's a drug that requires refrigeration, that refrigerator should only be for drugs and it should be locked as well. So everything should be under lock and key. And the only person that should have the key to the cabinet is the head athletic trainer or the athletic trainer in charge for that particular day. Now I just mentioned storage, but let's talk a little bit about it. Again, taken from the consensus statement, all prescription medications must be stored at all time in a locked cabinet or locked physician's bag that is environmentally controlled. So we're talking like room temperature, right? Controlled substances must be stored in a separate, they have to have their own cabinet or locked physician's bag. Does that make sense? And only accessible to those individuals that the physician writes in the policies and procedure manual, right? Over-the-counter medication should be stored in a locked cabinet that is only accessible to the physician, right? Athletic trainer and other appropriate personnel. The OTCs should not be stored with prescription medication. So think about it this way. If you have controlled substances, if you have prescription medications and OTCs, you have 3 separate storage places in which these medications need to be stored. Your controlled substances most often will go in the head athletic trainer's office because you really want to keep track of those. But you see here that our consensus statement says true false. prescription medications and over-the-counter medications can be stored together? The answer would be, yeah, right. It would be false, right, y'all? So those are things to kind of keep in mind. And it's why it's important that I put this, because your textbook doesn't go into this much detail. Okay, next we're going audit and reconciliation, which means you could be audited by the FDA or the DEA if you're storing controlled substances. It's random. And so this is why it's important for you to keep track of everything that comes out of your OTC prescription controlled substances cabinets. It's why you have to keep track of everything that goes into your medical kits, right? So if you put over-the-counter drugs and you're traveling, you have to keep track of how many of each you put in there, how many of each you put back, right? And so prescription medication, you should always be recorded in the patient's medical record. I'm going to say that regardless of what medication it is, it could be prescription, controlled, over-the-counter, you should always keep track of everything that you're giving your patient. So the name of the medication, the dose, what you've advised, any allergies to the medication, right? It's extremely important to keep track of all of those things in the patient's files, because again, one of those things, if we get audited and they look at the patient's chart and they don't see anything there, then you can be held liable for that. So just make sure, again, records should be kept of all OTC medications given to patients, including date, name of patient, medication quantity. So again, you're keeping track of all of this in your SOAP notes, right? And if that's the only thing the patient comes in to get, it's a quick SOAP note. Johnny B. The treatment area would be, I don't know, 400 milligrams ibuprofen and done, right? Signed. And then if you're a student doing that, you need to make sure the ATC signs behind you, because technically you cannot administer drugs because you aren't a licensed individual yet or a certified individual. So be careful there. Okay, now signage. It's interesting, right? Because one of the things that are the consensus statement and the textbook stated heavily was that there needs to be in every athletic training room an area or a room specifically designated for examination of athletes and the practice of medicine. So I'm going to ask you all, which clinical sites did you go to that had like, this is the physician's area, do not go in here kind of sort of thing? It's very, very rare. It's where like when people get audited, oftentimes it's where they actually get dinged. So look at your clinical site and see, like, in a true athletic training environment, is there actually a space that is truly like designated for the physician to have a private conversation to prescribe medications, right, to the patient? That would be one thing that I would look for as you begin your maybe fall rotations. Okay. Now, DEA requirements for controlled substances. I talked about this a little bit, but let's hit it a little bit harder, because controlled substances are, they have the potential to be harmful. So we said this already, they should be secure and they should be separate from OTC and prescription drugs. They should be in their own cabinet. I said they probably should just go in the head athletic trainer office. Now, you are going to do a biannual inventory of the controlled substances. So how many you have, how many you gave, you're going to report that. Non-licensed personnel need to notify DEA licensed professionals about controlled substances convictions. So let me say this a different way. If you are an athletic training student and let's say you're applying to an assistant athletic training position, and you previously maybe had an addiction to controlled substance, and let's say you had a conviction, you would need to let your head athletic trainer know. You won't be fired, but the reason for that is you wouldn't be able to handle, you wouldn't be able to administer any of the controlled substances. You would not be able to have a key, right? Because we know that psychological and physical dependence is relatively high, so we don't want to expose you to that, right? I talked about the physician making sure that there are separate registrations for each of the sites that are holding the controlled substances. And then you're going to, for those separate sites, you're going to have separate records of apposition and disposition of the controlled drugs. So you can see at every site, regardless of if it's on the same campus, if there are controlled substances in site A, B, C, D, and E, all of those sites need to be registered. All of those sites will have separate records, right? So you can see tight lock and key on controlled substance, because the concern is the potential for abuse. So travel. When we travel with teams, this will be key. Medications must be locked and secured at all times. Now, I'm going to not tell you that I've seen us just put these plastic things in our kits and travel and put them underneath the plane and pick up our kits, right? And we've done that. And so one of the things that I've suggested for students is, like when you put the zippers together, they come together, there's that little hole. You can just put a lock on there and that suffices, right? And it's safe because it means what happens if you have, the person at the airport putting your luggage underneath the plane and they have an addiction. They go in there, they see it, and they steal all of your drugs. Who's responsible for that? You are, right? And so we have to start thinking that way when we travel with drugs. Drugs ultimately are the responsibility of the team physician, but indirectly the responsibility of you if you're the one traveling with them, right? Who gets in trouble? The team physician for sure, but you're also going to get in trouble with your head athletic trainer if you're the head athletic trainer, with your athletic director. So make sure you lock your kits if you are traveling with over-the-counter prescriptions. Usually you wouldn't be traveling with controlled substances, but over-the-counter and prescription drugs, just buy a little cheap Dollar Tree lock and lock your kit. International travel is tricky because there really aren't any specific laws to address that, right? So just be careful. Know which state you're traveling to. Know what the regulations are for you in that state to administer drugs to your patients. And that concludes the this online lecture. So I hope you've learned a lot about how to manage drugs in your clinic, kind of why it's important to make sure that we actually manage them well. Looking forward to seeing you in our next online lecture.